Hello everyone, welcome to SCube TV. I am your host Rajni Bharara, and today on the show I have with me this special doctor once again. His name is Dr. Chava Anjaneyulu and he is an ENT surgeon. Today on the show we are going to speak with doctor about nose and all the issues related with nose. But before, it's our ritual, we would like to welcome him to SCube TV Global and we would like to thank him for taking out time and doing the show. Doctor, thank you so much for coming to SCube TV Global. And again, thank you so much for taking out time and doing the show. It means a lot.
Thank you, man. It is my great pleasure. Good evening.
Good evening to you too. So now, doctor, like I've mentioned to the audiences, while I was introducing you, that today we are going to talk completely about all the issues related with nose and all the problems that is related with nose. So before I ask anything to you, my very first question to you is, because the season is changing, the weather is changing. So these days people are having a lot of issue with cold. So they are, they are very, they are getting cold very easily. They are catching cold very easily. So how does that happen? And what is the connection between the weather change and cold? If you can please tell this to the audiences.
Yeah, usually with the weather change, atmosphere changes, certain viruses will increase their population wise. With the mutations, they will change that their genes also. With that, the pathogenicity will change. So most of the times when the weather changes, that time this virus will grow and that will attack the persons, those who goes in contact with them are near unhygienic conditions. And this, especially from warm to cold weather, is more prone to the cold infections. Because in these situations, in the nose also, with the cold exposure, the turbinates will become increase in size by vasodilatation, by increasing mucus secretion. When there is increase in mucus secretions, that will help to grow that virus. So whenever the weather changes, in weather changes, these mucus secretions will increase, that plugs will form, in that virus will grow and that will cause the more acute cold attacks.
But doctor, when cold or when people go through, people catch cold or cough, so they don't normally go to doctor and they don't normally directly go to, to the nearby doctor and go for a proper checkup. So they actually wait for a few days to so that the virus can get away. Can easily get away. So for how long should a person wait before they should actually go see a doctor if they have caught cold and cough?
Most of the times, initially, if the person is healthy, we don't have any other health issues, especially diabetes problem. If we take proper rest and proper food intake, most of the times this cold will come down. Like if there is till the time, 2-3 days, if we take care of it, by 2-3 days, that attack will come down. That intensity of the infection will come down by increasing our resistance. Basically, we can increase our resistance by adequate sleep, proper nutritional food intake, and a proper rest. Don't do more physically. You can do little bit walk in warm weather like that, but don't do intense physical activity like intense exercise, intense anything which increases your stress. So taking rest along with the proper sleep, along with the proper food, and along with that, if you take proper steam inhalation, that will dislodge your mucus plugs. Whatever the plugs is there in the nose, it will get dislodged. So usually mucus plugs are the site where the virus will grow. So these 4 precautions will help. These 4, if you take at an early stage, when you think you are getting, your body becomes warm, initial signs of cold like sneezing, little bit water discharge coming. If you take all these precautions, all these instructions, if you follow all these things, most of the times this cold will come down by 2 to 3 days. If after 2-3 days also your pains increase, if you have persistent fever, if you have persistent nose block, and if you have persistent headache and facial pains, along with that, if there is yellow or green secretions, you need to contact doctor and you have to get a proper medical treatment. Till that time, for 1 or 2 days, if you take the rest, your body pains will come down, your fever will come down, your weakness come down. Then most of the times you don't need to go the doctor. Only increasing symptoms along with the nasal blockage and nasal secretions is the hint for to check by doctor and to get the treatment by the doctor.
So doctor, also there, a lot of time what happened that they also, the patient goes to a nearby medical store or a chemist shop and they buy few medicines with, just by asking the chemist. So at that time, the chemist actually prescribes them a cough syrup or few medicines or few tablets. So at that time, would you recommend them to go take a cough syrup if they are having cough or cold. So would you recommend them to go directly to the chemist and take whatever they are prescribing?
I will not advise, but if a healthy person who has little bit cold initially with the body pains, he can take paracetamol, no problem. He can take antihistaminic, no problem. If 1 or 2 days, if you take your problem coming down, no worry, it is fine. But prolonging your medical prescription without doctor for long time, after 2-3 days also problem persists, just you are taking antihistaminic or analgesic, it is not good at all. So initial 1 or 2 days for a healthy person, it is fine. But after that, if your problem increase, don't take that chemist prescription, go to the doctor, get a proper medical treatment, total treatment. That means antibiotics, antihistaminics, nasal drops, if antacid, if there is a gastric. So take the proper total course of the treatment. If you don't take total course of the treatment, this will go into chronic stage. That is not good at all.
Also, doctor, what happens is when a person is going through cold, so a lot of times, especially at the night time, what happens is the nose gets blocked. So they have a lot of issue in breathing. So only when they sit for some time, they, the nose opens and they are, able to breathe with the nose. Otherwise, they mostly have to breathe with their mouth, when the cold happens and the nose gets blocked. So now what people are doing is they are going to the doctor, or I don't know if they're going to the doctor or not, but I've seen a lot of people, what they're doing is they are buying those small drops, those boxes of drops that actually they put into their noses, and it automatically opens the nose for a continuous 12 hours or 14 hours. So, such drops were not available, but now such drops are available, especially for the kids also, and also for the adults. So you being an ENT surgeon, would you say that those drops that people are using to get their blocked nose open, would you recommend them, and would you say they are safe and healthy?
It is not good at all, but once in a while, when rarely if you have acute attack, your nose gets blocked, but once or twice it is fine. But using nasal drops daily for opening of the nose, it is not good at all. It will increase your problem even after treatment due to rhinitis medicamentosa. That means rebound congestion. It is very serious adverse effects of the nasal drops. So it is not good at all. But once in a while, if you don't have doctor, or if you have severe nasal blockage due to early cold, you can use once or twice, not more than that. If you need to use the drops for a long time continuously, daily, you are getting nose block, you are going to use, it is not safe at all, it is not good at all. Even with that situations, we may miss the diagnosis, you may miss your actual problem, that problem may go up, increase day by day, especially nasal polyps, turbinate hypertrophy, sinusitis, all those things. So don't use that drops for a long time. Once in a while, acute stage, once in a while, you can use once or twice for acute cold. Don't use that. It is not advisable at all. Even that nasal drop, those who are giving ads also, they will specifically say under physician prescription, under physician advice. So always it is, you use those drops under physician advice, depending on, he will tell how many days you need to continue. So don't use for a long time that nasal drops.
Okay. So what are the severe effects that it might have later? So if one continuously is using those nasal drops?
Yeah, it is not good at all. With the drops, patient will develop rhinitis medicamentosa, that is rebound congestion of the mucosa. Even after medical treatment, if that happens, very difficult to clear that rhinitis medicamentosa problem. So don't use that. And the second thing is, if there is a severe infection inside or some tumors condition, some polyps, so they are using drops, their nose gets open up, they use again. So till that time that problem goes severely, patient may miss and you will not attend the doctor. So it is not good at all.
Okay. So doctor, what is the easy way to open a blocked nose?
Usually, if you have once in a while, rarely, better is do some pranayama breathing exercise, that means forceful inhalation and exhalation through alternate nose. Second one is steam inhalation. These two are the very good remedies for opening of the nose. Effective. Don't use nasal drop. This breathing exercise and steam inhalation, use that. If there is a more problem, use an antihistaminic tablet for temporarily 1 or 2 days. After that also, if you have problem, consult your doctor, find out the reason, take the medical treatment or precautions, whatever it may, breathing exercise, steam inhalation, avoid the dust exposure, take proper rest, avoid cold exposure, all those things you can follow. Most of the times, if your nose is clear, there is no problem. Most of the times, breathing exercise, steam inhalation will help to open up your nose.
A lot of cases, what has happened that, I actually have read quite few cases in which people have a complaint of continuous running nose. So when a person is going through continuous running nose, and they tend to feel that they might have got some allergy or some infection or something like that. So when they go see a doctor, so the doctor tell them that it is nasal polyps, if I'm pronouncing the name right. So it is called nasal polyps in easy language. For the general public, for the normal public, it is called as the nose, the bone of the nose has become bigger or has increased, which is called as nasal polyps. So please explain what exactly is nasal polyps and what happens in that.
Nasal polyps is the development of polyp from the nasal mucosa. There are mucous glands in the nasal mucosa. If that opening is blocked, inside that mucous secretions will go up and this will form the nasal polyps. Especially these nasal polyps, most of the times due to allergy. Those who have the nasal allergy, sneezing and running nose, they will develop over a period of time the nasal polyps. Second is the infectious problem. Infections also cause the nasal polyp. But in infection, usually most of the time single polyp will be there. But in allergy, there are many polyps that we call it as a multiple nasal polyposis. And in this allergy patient, there is a chance of fungal sinusitis, fungal infection is also more. Because in house dust, there the fungal elements will be there. That will deposit in the polyp mucosa and the sinus mucosa. It will cause the fungal sinusitis. So once the nasal polyps are there, it is better to remove it. Many people, they say, after removal of the nasal polyps, we may get the recurrence. But if you get the removal of the nasal polyps, after that, if you have any allergy, take immunotherapy treatment to control that allergy. And locally, you do the cleaning of the mucosa with the native wash. Most of the times, you get a permanent relief from this problem. If you neglect this problem, this nasal polyps convert into the fungal infection that even invade orbit and you may lose the vision, it may enter into the brain. All these serious problems will happen. So don't neglect if there are nasal polyps, don't think about the recurrence. First, you remove that nasal problem, polyps, either by surgery, immunotherapy, different methods depending on the intensity of the problem. Once you clear that nasal polyps, then you continue the native wash. That means cleaning of the nasal cavity with warm saline. With that polyps will not recur, and always it will clean the dust particles, fungal elements from the nose continuously. So it will that your polyps will not recur. So no worry if there are polyps. Go and get an endoscopic examination, CT scan of the sinus, paranasal sinus. On this test, you will know the extent of the disease. Remove that disease and get the medical management along with the native wash. You get relief from this nasal polyps.
I mean, are there any particular, is there any particular thing, not a particular thing, but I would like to ask you that, what kind of people develop a nasal polyps? Is there any criteria for those people?
Yeah, most of the times these polyps will come into allergy patients, especially we see many patients, especially those who work with unhygienic conditions, those who work with the dust areas.
Okay.
And it may be in the house, it may be in the land, agriculture land. Previously, in olden days, most of the times we see the farmers. Basically, they will work in there are a lot of dust particles along with the fungus that will deposit, and they will get the nasal polyps, especially in Haryana and Punjab. This is common. But nowadays, we are seeing in many patients in normal metro cities also, because they are working with dust atmosphere. Their houses may be dust. Many houses, they will not get clean regularly. That house with that means dusting indirectly, de-dusting or whatever you call it as. Many areas, this most of the times they keep the books and unused class for months together. There, these dust particles will deposit. Especially these are very dangerous dust particles because they will have the fungal elements in it. So those who are cleaning old books and home corners, you can say corners in the corners, there is a dust is there. Roof of the rooms, these will have the danger fungal particles. So most of the times these people, allergy people, those who work with the unhygienic conditions, house dust or agriculture dust, these people will develop the nasal polyps.
So, doctor, but a lot of people don't know actually about nasal polyps. So they think that when they get the running nose or when they get the cold, so they don't know they are not. It's not only connected to the allergy, but it is also connected to the nasal polyps. So when I ask you, how can we let people know, and how can we educate them about nasal polyps, and what can they do to prevent it from happening?
Yeah, always if you have allergy, periodically you get a nasal endoscopic examination. Those who have serious allergy problem, nasal obstruction, nasal discharge, sneezing, periodically once in a.
Sorry for interrupting you. So regardless of the age that you are in, so I mean of whatever age that you are, you should go for the for this test.
Yeah, irrespective of age, if you have continuous sneezing problem, nasal discharge, nasal obstruction, once in a year or once in 2 years, get a nasal endoscopic examination. There you can find easily if there are any polyps, you can easily diagnose and you can treat it. But to prevent that nasal polyps, especially those who have the allergy, that means sneezing, nasal discharge, nasal block, daily you do with the native wash, that Jalaneti, that cleaning of the nose with warm saline water. If you do that Jalaneti or native wash, that you can learn easily from any people, those who practice the yoga. So you can easily do that Jalaneti. With that, most of the times you can prevent the occurrence of this nasal polyps.
Okay.
So all allergy patients, those who have the nasal problem, especially, even they have allergy or not allergy, if they do pranayam, breathing exercise and Jalaneti, most of the times this nasal polyps will not form.
So now I would also like to ask you about sinus. So what exactly is sinus, and how does a person get sinus? I mean, what are the causes of it?
Usually sinus problem, that is inflammation or infection of the sinus. Infection is maybe due to bacterial infection, viral infection or fungal infection. But inflammation is due to allergy. So those who have the problems of the allergy, they are more prone to the sinusitis. There are many sinuses, maxillary sinus, sigmoid sinus, frontal sinus, sphenoid sinus. Any sinus can attack, but most of the times more than one sinus will get infected or inflamed. So we will call it as a pansinusitis or sinusitis patient. Usually this mostly sinusitis patients will have either anatomical abnormalities in the nose, either deviated nasal septum or inferior turbinate hypertrophy or nasal polyps or adenoid hypertrophy. The other is the allergy. Usually these anatomical problems and allergy will contribute to the sinusitis problem.
So is there something that also triggers the sinus?
Yeah, most of the times allergy and a common cold, these two are the triggers to the sinus problem. Those who get recurrent viral infection, cold, better to get a flu shot injections once in a year. Usually in Western countries, they will get every year flu shot injection. In India also now in all metros, those who are staying mostly in metro and those who travel very frequently, we advise them get the flu shot injections once in a year. That is preventing the recurrence of the sinusitis problem. One is that. Second one is avoid allergy exposure. If anybody is having allergy problem, we are doing a allergic skin prick test and we are finding what is the reason for allergy and we are giving immunotherapy treatment. So by avoiding viral infections and by treating that allergy with immunotherapy, we can prevent the sinus.
Also, doctor, if I talk about, what exactly are the symptoms of sinus? I mean, there are different, because there are certain symptoms of cold, but how do we differentiate that this is not just cold, but this is a bigger form, it is sinus. So how do we differentiate and what are the symptoms?
Basically, from cold, we have to differentiate the sinus by the duration of the problem. Usually, cold problem will stay for a few days only, but a sinusitis problem will stay for a few weeks or few months. Usually, acute cold and acute sinusitis problem, the symptoms are same: nasal blockage, nasal discharge, facial pain, headache. These are the common. But those who have the problem more than 1 week, 2 weeks, 3 weeks, these patients will have the sinusitis problem. So mainly duration will differentiate between cold and sinusitis problem.
Okay.
More days, more chance of the sinusitis.
So is there any particular treatment that should be taken care of, or that a sinus patient should definitely go for?
Yeah, usually once you diagnose, if there are no polyps on endoscopic examination, in CT scan also there is no much sinusitis, only minimal problem. You can treat initially 1 week, 10 days medical management, antibiotics, antihistaminics, nasal drop. After that, if there is allergy, ask the patient to go for immunotherapy. If there is any sneezing problem also, we ask the patient to take few months antihistamine. Mainly, along with this medical management, we will ask the patient to do Jalaneti and Pranayam daily. Regularly, he has to do Jalaneti once or twice a day, same Pranayam once or twice a day for 15 minutes to half an hour. That will help him to clear the nose and to keep the nose very healthy. Along with that, we ask the patient, don't go into too much cold weather. Better to expose morning and evening little bit warm weather. Along with, we have to check the patient vitamin D levels also. If the patient vitamin D levels are low, there is a more chance of sinusitis problem. So we treat the patient from all sides. We ask the patient to avoid allergy exposure. We ask the patient to do moderate exercises and moderate sun exposure. If there is a vitamin D deficiency, we treat that vitamin D deficiency. Along with that, Jalaneti and breathing exercise will help the patient a lot.
I would also like to know, a lot of people also say the sinus is something that cannot be completely cured. So as an ENT surgeon, what would you like to tell? Can sinus be cured or not?
Yeah, if you find the problem properly, if you both the doctor and patient will target a cure of the disease, most of the times this can get cured. Basically, along with the medical management, with the doctor knowledge, patient cooperation, indirectly patient following instructions is very important. We treat the disease by medical management or surgery depending on the need. Most of the times, if there is no much sinus problem, we treat medically. If there is a much sinus problem along with the polyps, we treat with the surgery. Once after surgery, patient has to follow the main instructions of the doctor. That is immunotherapy. If there is allergy, Jalaneti and Pranayam. He has to follow this many years, indirectly or lifelong. If we follow along with the medical management, all these precautions, regular moderate physical activity, breathing exercise and pranayam, most of the times this sinus will get cured, patient will be asymptomatic. If patient will not follow these instructions and the patient will not do moderate exercise, if he exposes the dust and cold weather more and more, if his body resistance is less, maybe due to by his nature or due to other problems, diabetes, this chance of sinusitis will get cured is less. So get the proper treatment by the doctor and follow the proper lifestyle by yourself. Most of the times you get relief from the sinusitis problem.
Thank you so much, Dr. Chava Anjaneyulu, for coming to SQ TV Global and speaking with us. It was again such an informative episode, and I'm sure people must have gained so much out of this episode and out of what all knowledge you have given. So thank you again for doing the show and coming to the channel. It means a lot.
Thank you.
All right, guys, that's